myself J. Pushpakalani. I am from JK Dental College and Hospital in BTS first year student. Today I am going to talk about anatomical landmarks of maxilla and mandible. The anatomical landmark of maxilla is divided into three parts. Limiting structure, supporting structure and relieving structure. The limiting structure is labial frenum, labial vestibule, buccal frenum and buccal vestibule, humulus notch, posterior palatine seal. The stress bearing area or supporting area is a primary and secondary. Primary is a hard palate, slope of residual alveolar ridge. Secondary is a rugae maxillary tuberosity. Relieving area is a incisive papillae, cuspid eminence, fovea palatine, torus palatinus. Labial frenum is a fold of mucous membrane is extending from the mucous membrane of the lips toward the crest of the residual alveolar ridge. The clinical significance is the limit to the labial fledge of the denture. The labial vestibule is runs from on the buccal frenum to the other on the labial side of the ridges. The clinical significance is provided a peripheral seal of the denture is orbicularis oris muscle is indirect effect of the width of the labial fledges of the denture. A buccal frenum is there, and the buccal frenum is a fold of mucous membrane is extending from the buccal mucous membrane is relieving and toward the slope of the residual ridges. The clinical discussion is due to the actions of the orbicularis oris of the buccinator muscles is a required for the more clearance of the denture is the frenum is causes a denture of the dislodgement of pain in this region. Buccal vestibule is the extension of the buccal frenum to humulus notch. Is a various contraction of the buccinator muscle in the portion of the mandible. Clinical significance is a distal end of the fledges of the denture is must to adjacent to the coronoid process of the mandible. Humulus notch is there. This is situated beneath the tuberosity and the humulus notch and the medial pterygoid plate. These are located in the 2 to 4 mm of posterior medial to the distal limit of the maxillary tuberosity of the residual alveolar ridge. The clinical significance is posterior boundaries of the maxillary denture retention. These are under the extension of the humper denture retention. The posterior palatine seal is a soft tissue area is limited posteriorly by the distal dermatures of movable and non-movable tissue of the soft palate is anteriorly by the junction of the hard and soft palate in which pressure within the physiological limit is placed to apply the removable complete denture to aids in its retention. Is divided into two parts, posterolateral seal and a pterygomaxillary seal. The clinical significance is the retention and reduction of the gag reflex is reduce the food accumulation is a compensate from the volumetric shrinkage of the resin. Is a stress bearing area or supporting area is a primary is a hard palate and residual alveolar ridge. Secondary is a rugae and maxillary tuberosity. The hard palate is there. These are anteriorly to the hard palate. These are formed a palatinous sleeves of the two maxillary bones. These are posteriorly to the palatine bone is underlying. The anterolateral surface of the hard palate is contained to the adipose tissues. The clinical significance is act as a primary stress bearing area. The residual alveolar ridge is there. This portion is a residual alveolar ridge. Residual bone is a soft tissue is covering the remain after the removal of the tooth. After the removal of the tooth, these are from the formation of the denture. It has underlying to the consequence of the bones is resorbed under the constant stresses. The clinical significance is supporting of the denture bases. The palatinous rugae is a rugae of the rhizus area of the dense connective tissues. The residual alveolar ridges in the median in the surface is in the anterior of the 2/3 of the palate. The clinical significance is provided the antero-posterior resistance of the displacement of the denture. The maxillary tuberosity is there. These are the posterior convexity of the maxillary body, or is termed to the maxillary tuberosity or tuber. These are the bulbous extension of the residual ridges in the second or third molar, the second or third molar region. The clinical significance is the alveolar tubercle supporting the denture is act as a stress bearing area. Relieving structure is the incisive papilla, cuspid eminence, fovea palatine, and tarsus palatinus. Is incisive papilla. Incisive papilla is a pad of fibrous connective tissue. These are overlaying to the orified the nasopalatinous canal. The mid-palatine raphe, will be there. This palatine is a structure. This area is extended from the incisive papilla to the distal end of the hard palate. The mucus over the area is usually tightly attached, non-resined and thin, underlying a bony union, being very dense or often rises. The fovea palatine, these are three or two there are two granules opening or will be there. The fovea palatine, these are the ductal opening which duct of the palatal mucus gland drains us. Palatinus torus is a hyperplastic overgrowth of the bone is called palatinus torus. Is seen in the mid-palatine area. These are covered by the thin mucous membrane. Is a extension due to the clinical significance. Is a surgical removal is indicated the less extensive. Anatomical landmarks of mandible. These are the limiting structure. Limiting structure is a labial frenum, labial vestibule, buccal frenum, buccal vestibule, and retromolar pad, alveolar linguosulcus, lingual frenum. Stress bearing area is a primary stress bearing area, is a buccal self, retromolar pad. Secondary stress bearing area is residual alveolar ridge. Stress relieving area is a secondary stress bearing area, retromylohyoid ridge, genial tubercle, and strap bony prominence of ridges and mental foramen. Anatomical landmarks of mandible is a mandible limiting structure is a labial frenum is there. Labial frenum, labial vestibule, buccal frenum, buccal vestibule, retromolar pad, alveolar linguosulcus, lingual frenum. Next, stress bearing area is a primary stress bearing area, secondary stress bearing area, the buccal shelf, retromolar pad, and the residual alveolar ridges. Relieving structure is a retromylohyoid ridges, genial tubercle, and prominence of ridges, mental foramen. Labial frenum. Labial frenum is a fold of mucous membrane is extending from the inner aspect of the lip of the mandible. These are consistent to the orbicularis muscle. The clinical significance is indicate to the denture extension. Indicate the denture extension. Labial vestibule. Labial vestibule is there. The mandibular labial vestibule is extension from the ridge of the buccal frenum to the left, too soft elevation on the each side of the frenum. These pad make origin of the mentalis muscle. The clinical significance is the extension of the denture borders in this region. These are overextension of the mentalis muscle leads to the displacement of the mandibular denture. Buccal frenum is a fold of mucous membrane. These are extension from the buccal mucous membrane. These are reflected the area over the slope of the residual ridges, and these are dividing a line between the labial and buccal vestibule. It over a depressor labioris muscle. These are relieving the denture is avoided the displacement of the denture. Labial buccal vestibule is an extension of the posterior form of the buccal frenum, and posterior palatinus extension of the myeloid anterior and posterior pterygomandibular raphe in the posterior. Distal buccal border is the buccal vestibule. These are bounded to the vertical fibers of the masseter muscles. Retromolar pad is a triangular pad of the tissues. These are the distal end of the residual ridges. The anterior portion and the posterior portion will be there. The anterior portion of the triangle is a keratinized. The posterior portion of the triangle is a non-keratinized. The anterior portion of the triangle is keratinized in the form of the gingiva. The third molar is a pear shape. Posterior aspect is a attachment of the loose connective tissue, glandular tissues, and fibrous temporalis tendinous, and buccinator muscle, superior constrictor muscle, and pterygomandibular raphe will be there. Then retromolar pad. Clinical significance is a primary stress bearing area. These are provided to the peripheral posterior stele of the structure, the soft palate of the stele, distal to the last molar is approximately in the retromolar pad at the established to the occlusal vertical dimensions. Alveolo-lingual sulcus is a shape between the residual ridge of the tongue. These are extended from the lingual frenum to the retromylohyoid curtain. Is a sulcus. These are three form: anterior region, middle region, and posterior region. Anterior region is extending from the lingual back of the mylohyoid ridges. These are extension. Middle region is extension from the pre-mylohyoid fossa. Posterior region is extension. The flage passes through the retromylohyoid fossa. Lingual frenum is there. This is a fold of mucous membrane seen of the tip of the tongue is elevated to the entire the cord like a fan shaped and record the formation of the frenum. Clinical discussion is a lingual extension of the denture. The frenum is a character to affect the stability of the denture. The buccal shelf area is there. These are anteriorly to the mandibular buccal frenum, posteriorly anterior edge of the masseter muscle, medially the crest of ridges, laterally buccal external orbic ridges, distally a retromolar pad. Residual alveolar ridges is there. The crest of the residual alveolar ridge is covered by the fibrous connective tissue. A slope of the ridges in the cornicus bones without a good cortical bone plate covering it. The clinical significance is a secondary stress bearing area. Genial tubercle. These are the crest of the residual alveolar ridge. This is covered the connective tissue. The slope is a kind of these are the. It is attached to the tongue. Mental foramen is one of two foramina. Foramina is located on the anterior surface of the mandible is the first and second premolar region. These are transmitted mental nerves and vessels. The excessive pressure from the mandibular buccal flagelles in the region may causes a numbing sensation at the corner of the mouth. The retromylohyoid ridge is a bony prominence along the lingual aspect of the buccal mandible. It is containing to the posterior attachment of the nearer the alveolar ridges. These are nearer the submandibular salivary gland or presence. The surgically the clinical significance is the posterior prominence is refers to the denture and may require the surgical retention. Mandibular tori. Mandibular tori is a torus mandibularis is founded on the lingual chronicle surface of the mandible is located on the premolar area. These are usually keratinized in the non-mobilized tissue. These are require the removal of the sleeving limit or extension of the denture in the floor of the mouth. The smaller tori may only require relief in the denture. Thank you for giving me this opportunity by J. Pushpa Kalyani from BDS first year student. This concept is gathered from ChatGPT, Google Gemini. It can be edited from Canvas app. Thank you, sir.